Blood coagulation. The fluidity is essential for circulation, while clotting is required as a defense during blood loss. The blood coagulation is nothing but a complex cascade of reactions in which final step is conversion of fibrinogen to fibrin thread forming network in which cellular element get entangled is blood coagulation. When we see this blood coagulation in detail, clotting factor is one of most important part of it. When we see this cascade mechanism, that means the stepwise activation of certain substances, mostly protein in nature present in blood or tissue. When we see this number of clotting factors, that factor 1 that is known as fibrinogen, factor 2 prothrombin, factor 3 tissue thromboplastin, factor 4 calcium, factor 5 level factor. Now when we see this factor 1 fibrinogen, which is globulin synthesized in liver, factor 2 prothrombin, which is inactive precursor, factor 3 tissue thromboplastin, that is extrinsic pathway, factor 4 calcium, which is required at various stages of this cascade mechanism, factor 5 level factor, which is unstable in plasma, which is absent in serum. When you see this factor 7, that is stable factor, which is synthesized in liver in the presence of vitamin K present in serum. Factor 8, that is known as anti-hemophilic factor. Factor 9, Christmas factor. Factor 10, Stewart for factor, which is synthesized in liver. Factor 11, plasma thromboplastin antecedent. Factor 12, Hegman factor or contact factor. Factor 13, fibrin stabilizing factor, which is high molecular weight kininogen. Now these are such 13 factors which plays an important role in this process of blood coagulation. When we see this mechanism of coagulation, that is clot formation is the first step, which is initiated by first trauma to vessel wall and adjacent tissue, trauma to blood, contact with damaged endothelial cells. These three factors are responsible for clot formation mechanism. This clot formation mechanism is the first step or first stage in mechanism of this coagulation. The enzyme cascade reaction, that is waterfall sequence, each factor activates to next factor in huge quantity of other factor, that is known as bioamplification. When you see, there are three main steps of this coagulation process. First is formation of prothrombin activator. Second is prothrombin to thrombin conversion. And third one is conversion of fibrinogen into fibrin. These are the three main steps of coagulation. Just remember this very carefully, the three main steps of coagulation, because this is an important point what you should correlate with other factors. In these three steps, first step is formation of prothrombin activator, second step is prothrombin to thrombin conversion, and third is fibrinogen to fibrin conversion. When you see this mechanism for formation of prothrombin activator, there are two mechanisms respectively, extrinsic mechanism and intrinsic mechanism. The extrinsic mechanism, that is initiation of clotting by tissue thromboplastin from damaged vascular wall of tissues, while intrinsic mechanism, initiation of clotting by trauma to the body by activation of platelets and involves factors present in blood itself. Now this is the schematic presentation of extrinsic mechanism, that means trauma to the tissue which causes release of tissue thromboplastin 3 and activation of factor 7 by activated factor 9. This is the first step, that is in extrinsic mechanism. While versa, in intrinsic pathway initiated by exposure of blood to wettable surface or collagen. Here in plasma, attachment of HMWK, activation of factor 7 This is the schematic presentation of intrinsic pathway. This is the schematic presentation of intrinsic pathway. While when say this is the another third one, that is a common pathway in which there is seen thrombin formation from prothrombin, from prothrombin which is converted into thrombin. While another one, that is in formation of cross-linked fibrin fibers. This is the coagulation pathway which is showing all these steps, that is respectively intrinsic pathway, extrinsic pathway and common pathway as a common. Just note this schematic chart diagram where we see activation of this both pathways, that is respectively extrinsic and intrinsic pathway, and respectively conversion of prothrombin to thrombin and fibrinogen into fibrin. When there is a conversion of, before that, when we see this activation of both intrinsic pathway and extrinsic pathway, both activates this factor 10 which is converted to 10A, which converts this, that means prothrombin into thrombin. Once thrombin is formed, this thrombin converts or helps for the conversion of fibrinogen into fibrin. This is again similar presentation which is given in our book, that is respectively extrinsic pathway, intrinsic pathway, common pathway and conversion of prothrombin into thrombin. This is the intrinsic pathway where we will see the conversion of prothrombin into thrombin by the activation of cascade mechanism via intrinsic pathway. Now afterwards we go to the next step, that is the formation of thrombin. Formation of thrombin, that enzyme from prothrombin rate is directly proportional to quantity of prothrombin activator, which is proportional to degree of trauma to the vessel wall. Clot formation starts at the site of injury because prothrombin activator is formed on the surface of activated platelets. When you see the role of thrombin, what is the role of thrombin? First, it helps in conversion of fibrinogen to fibrin. Second, positive feedback role of thrombin, which is important. And third, activation of protein C anticoagulant. These are the role of thrombin. When you see the role of calcium in coagulation, calcium is required for all steps for the promotion except first two steps in intrinsic pathway. When you see the role of vitamin K, it is a source that is from green vegetables, cereals, bacterial flora in premature infants and need to inject vitamin K, which are required for the synthesis of prothrombin and different coagulation factors like factor 7, 9, 10 and anticoagulant proteins. In vitamin K deficiency, prothrombin time and blood clotting time is increased, that is hemorrhages. When we see the role of liver, that is synthesis of procoagulants 1, 2, 7, 9 and 10. Removal of activated procoagulants, synthesis of anticoagulants like heparin, antithrombin 3 and protein C. When we see the last, the role of blood vessels, that is endothelium forms barrier, produces heparin, alpha 2 macroglobulin, prevents platelet aggregation, prostaglandin, that is PGI2 opposes aggregation and secretes one wheel drop factor, that is VWF factor, TF, plasminogen activator, etc. These are the important role of blood vessel in this process of blood coagulation.